When people think about Switzerland, they usually think about trains, mountains, chocolate, and very high salaries. But sooner or later, every expat discovers something else: the healthcare bills. And for many newcomers, the first reaction is shock. Because in Switzerland, healthcare is not free, not cheap, and definitely not simple at first glance. You pay monthly premiums, you choose deductibles, you receive invoices in the mail, and somehow, despite spending thousands every year, you still keep paying out of pocket. So why do the Swiss tolerate this system? And perhaps more importantly, how does it actually work? Because underneath the complexity lies one of the most effective healthcare systems in the world. Today, we're going to break it all down: the private insurance model, why health insurance is mandatory, premiums, franchises, deductibles, and copayments, accident insurance, emergency treatment, safety nets for low-income residents, and why healthcare in Switzerland feels so different from many other countries. The first thing that surprises many foreigners is this: Swiss healthcare is private, but it's also universal. That combination confuses people, especially Americans and Europeans, for completely opposite reasons. Americans hear universal and imagine government-run healthcare. Europeans hear private and imagine a free market system with gaps in coverage. Switzerland is neither. Instead, the Swiss created a hybrid system. Every resident is legally required to purchase basic health insurance from a private company, not optional, mandatory. And this applies to Swiss citizens, permanent residents, work permit holders, most long-term foreign residents. Once you officially move to Switzerland, you typically have 3 months to obtain insurance coverage. And here's the important part: insurance companies are legally required to accept everyone for the basic plan. They cannot reject you for pre-existing conditions. That's one of the foundations of the system. The mandatory basic plan is called the Grundversicherung in German, or Assurance de Base in French, and regardless of which insurer you choose, the coverage itself is defined by law. That means basic coverage is essentially standardized. Your insurer changes, your premium changes, but the core medical coverage stays largely the same. Basic insurance generally covers doctor visits, hospital treatment, emergency care, prescription medication from approved lists, maternity care, many preventive services. And in serious situations, Swiss healthcare is excellent. The hospitals are modern, the equipment is advanced, and access to specialists is usually very fast compared to many countries. Now we get to the painful part: the cost. Swiss healthcare is excellent, but it is not cheap. Unlike systems funded mainly through taxes, Switzerland places much of the cost directly on individuals through monthly premiums and out-of-pocket payments. So even healthy people pay significant amounts every month just to remain insured. And premiums vary based on your canton, your age, your insurance model, your chosen deductible, sometimes even your postal code. In cities like Zurich or Geneva, premiums can become extremely expensive. Families especially feel the pressure. For many households, health insurance is one of the largest monthly expenses after rent. Understanding the franchise deductible. This is where many newcomers become confused. In Switzerland, your franchise is your deductible. This is the amount you agree to pay yourself each year before insurance begins covering costs. Adults can choose franchises ranging from 300 francs up to 2,500 francs, and your choice directly affects your monthly premium. A higher franchise means lower monthly premiums, but higher out-of-pocket costs if you get sick. A lower franchise means higher monthly premiums, but less financial risk during treatment. So essentially, you're balancing risk versus predictability. Young, healthy people often choose high franchises. Families or people with ongoing medical needs often choose lower ones. But even after you hit your franchise, you still pay part of the costs. This surprises many people. Once your deductible is reached, insurance usually covers 90% of additional medical expenses. You cover the remaining 10%. This is called the co-payment. Fortunately, there's an annual cap. Otherwise, medical bills could spiral indefinitely. The philosophy behind this system is very Swiss. People should contribute personally to the cost, so healthcare isn't overused. Whether you agree with that idea or not, it's deeply embedded in the structure of the system. Now here's something many newcomers miss entirely. Health insurance and accident insurance are often separate. If you work in Switzerland for more than a minimal number of hours per week, your employer usually provides accident insurance automatically. This covers workplace accidents, non-work accidents, emergency treatment related to accidents, and in many cases, accident coverage is actually better than regular health insurance coverage. If you're employed full-time, you often remove accident coverage from your personal health insurance plan to reduce costs. But freelancers, unemployed residents, and some part-time workers need to ensure they remain covered privately. This distinction is incredibly important, because without proper accident coverage, a skiing injury can become financially unpleasant very quickly. And in Switzerland, people ski a lot. Basic insurance is mandatory. Supplemental insurance is optional. And this is where the system starts resembling a premium consumer product. Supplemental plans can include private hospital rooms, alternative medicine, expanded dental coverage, international coverage, faster specialist access, enhanced comfort during hospitalization. Unlike basic insurance, supplemental insurance providers can reject applicants, so this part operates much more like traditional private insurance. Some Swiss residents barely use supplemental coverage. Others treat it almost like a status symbol, especially private hospital rooms. In Switzerland, healthcare quality is already high. Supplemental insurance mostly changes comfort, convenience, and flexibility. At this point, many people ask the obvious question, what happens if someone simply cannot pay, because premiums can become very expensive? The answer is that Switzerland does have safety nets. Each canton offers premium subsidies for lower-income residents. These subsidies can dramatically reduce monthly costs. In some cases, they cover a substantial portion of premiums entirely. So while the system is expensive, the state does intervene to prevent complete exclusion. And hospitals are still obligated to provide emergency treatment. Switzerland is not a system where uninsured people are simply abandoned. But the bureaucracy can be complex, and newcomers often don't realize assistance exists. Daily healthcare in Switzerland feels highly organized. Appointments are usually punctual. Clinics are efficient. Pharmacies are professional and highly trusted. In many situations, pharmacists can provide guidance that might require doctor visits elsewhere. And Swiss doctors tend to spend more time with patients than in many overloaded public systems. But convenience comes at a cost. Even relatively small appointments can generate surprisingly large invoices. This creates an unusual psychological effect. In some countries, people hesitate because healthcare access is difficult. In Switzerland, people hesitate because healthcare access is expensive. Despite all the complaints, the Swiss healthcare system consistently ranks among the best in the world. Outcomes are excellent, hospitals are modern, waiting times are relatively low, and patients generally have significant freedom of choice. You choose your insurer, your doctor, your insurance model, your deductible level. That flexibility is highly valued in Swiss culture. The trade-off is cost. Switzerland prioritizes quality, access, and decentralization, but those things are expensive. To really understand Swiss healthcare, you need to understand Swiss culture. Switzerland strongly values personal responsibility, competition, decentralization, choice. The healthcare system reflects those values perfectly. The government guarantees universal access, but individuals still carry responsibility for participating financially. That balance between collective obligation and personal responsibility is deeply Swiss. Swiss healthcare can feel overwhelming at first. The terminology, the bills, the premiums, the endless letters arriving in your mailbox. But once you understand the structure, it begins to make sense. It's not designed to be cheap, it's designed to be reliable. And in Switzerland, reliability is often considered worth paying for. Even if the invoices still hurt.